Now, this comes from WFLA News, Florida news station in Tampa Bay. They have a pretty scary report here. Let's go ahead and check it out.
What are we looking at? This is
Oh, wow.
a lot of people. So if you think that the beaches are being impacted here by coronavirus, by COVID-19 and by the new cases that are emerging here in Florida, this is Clearwater Beach here, everybody.
That looks like Clearwater.
And one of the questions that we were asked here earlier was whether or not the beaches were going to be impacted by what's going on here with coronavirus in the state of Florida. By the looks of it, this looks to be a pretty busy day here at the beaches. A lot of people here in the water. We know that Miami Beach and Fort Lauderdale Beach and some others in South Florida have.
So this is posted yesterday, March 16th, where it says that Florida is packed today despite social distancing recommendations. So social distancing is a key piece where you're basically supposed to keep your distance from other human contact. You got to prevent the curve, and you got to prevent exponential growth in terms of numbers of cases that end up coming up. And so that's what you're trying to prevent. And so when you see all of these people around each other, all around each other going into the same water, there's just so many people. And, I saw this in Disney World. It was packed shoulder to shoulder. That's obviously also in Florida. So I'm starting to see a trend here. It seems to be the case that Floridians just, maybe they're not, to put it nicely, let's say they're not the brightest. How about that? Let's put it nicely for the Floridians. But when you've got coronavirus going around and then you're all congregating at a beach like this, this is bound for a disaster, and this is something that's going to result in basically mass coronavirus, COVID for everybody. There's 19 new cases now. The reason why I don't even really care about the numbers of like, oh, look at how many confirmed cases we have. The real number of how many cases we have in the country has to be somewhere around like 500K to a million easily. Ohio, they guessed that they had 100,000 in their state just off of their own state, one state of Ohio. They said we probably have 100K. So honestly, I'm probably being pretty conservative with the 500K to 1 million case number because you have 350 million people in the country, and this fucking thing spreads like wildfires, okay? Seriously spreads insane. And so the real confirmed numbers, we don't test anybody, right? South Korea, for example, they were just like, yo, we're going to test literally everyone and their grandma, all right? And they were just had drive-thrus. You just come in, test, get your test, and get your results back. That's a beautiful thing. I wish we had that here, but Donald Trump was trying to keep, according to reports, and this was what was confirmed, Donald was trying to keep the numbers down to save his his re-election chances. So that resulted in continued sort of growth of the issue, and so we don't really know the number of confirmed cases, and so the confirmed cases are super low. Now, unfortunately, it looks like we're on the curve to be on the same path that Italy was. Italy waited too long to actually respond to this crisis, and look at what has happened. Their country is literally on the verge of complete collapse right now, because the problem is obviously, once your healthcare system gets overrun by COVID, and then you have no capacity to deal with anything else, you're in big trouble at that point, because there's like normal things that people have to deal with, right? It's not like just because there's COVID, all of a sudden, all of the pre-existing problems that were going to happen inevitably are going to be, just gone, right? So people are going to have strokes, they're going to have aneurysms, they're going to have heart attacks, they're going to have all kinds of shit. They're going to break their legs, going to have injuries. But how do those people get help if the hospitals are already filled with COVID patients and they're completely overrun? How do you get that surgery to get your emergency stroke fixed? How do you get a quick attention for a heart attack? You know what I mean? So I feel bad for all the people who are going to deal with that, because there's just simply not going to be enough help. I mean, they're basically starting to be like, okay, we have to pick and choose who we're going to care for here. And so it's really scary, honestly, but this is not what you're supposed to do. And so governments need to take a harder, look at banning all beaches. Nobody should be allowed on beaches, period. Especially when you're talking about water, bro. It's crazy. But really, really bad. Really, really bad for the spreading. But this is going to be a much bigger problem than just this for a long time coming.